All right, so right now we are going to have Margaret Tompkins, president of the Tompkins Foundation for Feline Leukemia Advocacy, Mixed Households. Can you, should you, or will you? Margaret Tompkins is president of the Tompkins Foundation for Feline Leukemia Advocacy. She's a tireless advocate for feline leukemia education and FeLV-positive cats. She actively networks with FeLV-positive cats all over the country, and she is active on social media, especially Facebook, in promoting adoptions and education. She's a huge proponent of TNR and supports shelter and rescue programs that provide positive outcomes for feline leukemia positive cats. And I'm sure Margaret will share her email, but we will also make sure everybody has her. There you go. Her email is right there on the screen. All right, I'm going to hand the mic over to Margaret. Oh, Margaret, you are still muted. There you go. You should be there. Whoop.
Okay. Thank you very much, Stacy. I appreciate that. And we want to start with some polls. If you've got those handy, let's put those up.
Sounds good. I will do that right away. Here we go. All right, couple of polls here. All right, here we go. How many feline leukemia positive cats have you encountered? None, 1, 2 to 5, 6 to 20, and more than 20. Just give it a couple more seconds. All right, I'm gonna close the poll, share the results. Oops. Okay, and then what we have here, so we have 16% say none, 6% 1, 40% 2 to 5, 20% 6 to 20, and 18% more than 20. And then I think there's one more poll. Oops, sorry.
Oh, what was that next to the last number?
20% with 6 to 20 cats.
Very good. Okay.
All right. And then I'm going to go to the next poll. What do you do with feline leukemia cats? Do you adopt them into loving homes? Do you send them to a sanctuary? Send them to foster, long-term foster, or hospice care? Send them to rescue group or euthanize them? All right, just a couple more seconds. I'm going to close the poll, share the results. So we have 69% adopted to a loving home, 2% send them to a sanctuary, 5% send them to foster, long-term foster, or hospice care, 17% send them to a rescue group, and 7% euthanize them. And I believe, is there one more, Margaret?
Yes, there's one more.
One more. Okay, here we go. Do you approve of mixed households? Mixed households are homes where owners allow their feline leukemia positive and feline leukemia negative cats to live together. I don't know. Sometimes it's okay to have mixed households or never. Oh, this is interesting. I love these polls. I could do polls all day long. All right, I'm going to close the poll and share the results. We have 29% that say I don't know. 17% says sometimes. 44% say it's okay to have mixed households. 10% say never.
Okay, that's fabulous information. Just briefly, I'd like to speak to the polls. That first one, we asked how many FeLuke cats you've encountered, and it's like 80% of the audience here today, they've encountered some FeLuke cats. And that tells me that we're not euthanizing them like we once were, that we're saving these cats and adopting them into homes. So that's just wonderful news, certainly to me. And then what do you do with these cats? And you've made my day when 69% say that they are adopted into loving households. That's incredible. That has gone up so much in just the last year or two. So we finally, I think, are doing the really great things for cats. And as a whole, it looks like 93% have positive outcomes for these wonderful cats. So we're still euthanizing about 7% of them. So we have more work to do, but certainly we're moving in a positive direction. And then we have mixed households. And this number just totally blows me away in that a year or two ago, we had like 70% of people that were really unsure as to whether this was okay or not. They hadn't made up their minds. Maybe they hadn't had an opportunity to think about it, but now they have. And it's like we're finding that a lot of people now are recognizing that mixed households are not the worst thing that could happen to a FeLuke cat. So we're doing much improved in that we're understanding what it takes to support a FeLuke cat and whether we should put them into mixed households or whether we should avoid it or whether it's something in the middle. So that's just exciting news for me. Now, all of the cats that you'll see in this presentation are FeLuke cats, and they're ones that have been certainly instrumental to me and inspirational. We will look at some special things about FeLuke cats in general, and with an emphasis on how you should look at this information when it comes to mixed households. This is certainly some important information for you here. We absolutely want to stop killing cats just because they have a virus. That's really old school, and we're not doing that anymore, and we really want positive outcomes for these cats. We know that feline leukemia is not nearly as contagious as we once thought. We know that it's how it is spread, and it is spread by cats having kittens and also by adult cats fighting and mating. Those are the predominant methods of spreading the virus. We have wonderful new tests, such as the quantitative PCR test, and we'll be talking about that. And we have some excellent vaccines. In particular, Merck has a new vaccine that's a 2-year vaccine, which makes it far more convenient for adopters. And adoption, the key takeaway today is adoption is the outcome that we want for these feline leukemia cats. And this is the recommendation from the American Association of Feline Practitioners. This is the group that gives guidance to shelters, veterinarians, rescue groups, veterinarians, everybody across the board that deals with cats. This is the guidance that they give to them, and they produce guidance of all sorts on everything from testing protocols to vaccines, and this is their guidance for FeLV-positive cats that they recommend adoption. And that guidance came out 4 years ago this month. So it is just wonderful to realize that message has now finally resonating with people that are out there in the field working with cats. So that's a wonderful news to everybody. Now, these are some basics. Feline leukemia. We know that it's a retrovirus and it affects cats only, so it's not going to hurt your dog or anything else. And outside of the cat, it's a very fragile, wimpy virus. It doesn't live long and it's easily killed by just washing your hands. Now, inside the cat, it can be devastating. It compromises the cat's immune system, so the cat is much more prone to getting these secondary infections and diseases. So it's not the FeLuke that we treat, it's really those secondary infections and diseases that we treat for a FeLuke cat. We know that different cats can have different immune responses. That immune response is the most important thing for a FeLuke cat, and it's different for each and every cat. We know that some cats can fight off the virus for many years. And we also have learned that certainly the number one method for transfer of the disease or for the virus is from cats having kittens. So the queen to kitten link is the number one method of spreading the virus, and then adults can also spread the virus by fighting and mating. That's why it's so important to spay and neuter cats, and we will talk more about this. This is how it's spread. It is by those cats fighting and mating, and certainly the number one is queens having kittens. So just getting cats spayed and neutered is substantially going to reduce the spread of FeLV. FeLV involves, generally, it's saliva to blood transfer. So the virus is in the mouth of a cat, on the teeth of the cat when it bites into another cat. So that's how adults spread it. It is the saliva to blood transfer or blood to blood transfer is how most FeLV is spread. Now, we've always heard that, it can be spread through water bowls, and we'll talk a little bit more about that, but that is so extremely rare. It is possible So it's not a myth, but it is very improbable that will happen. However, it can be shared and transferred through long-term mutual grooming. And of course, since it's mostly a blood-to-blood type transfer, we know that FeLV can be spread by blood transfusions. Certainly, it is important that we spay and neuter cats. And that's why I love TNR people so much. And they're always focusing on population control. So give yourself a pat on your back if you're a TNR person and you're helping control the cat population and the kitten population. And give yourself another pat on the back for disease control. If you get cats spayed and neutered, this is how those nasty viruses get spread. Not only FeLV, but FIV, and also other diseases and parasites, anything that is a blood-to-blood transfer. If you can stop it by getting the cat spayed and neutered, you are doing a wonderful work just in disease control. So pat yourself on the back for both of those things. Now, we know that FeLV is just not nearly as contagious, we want to talk about how it is spread. We know that it's this saliva to blood transfer from queen to kitten, and also it's a horizontal transfer between adult cats getting in fights with each other. Now, just some basics about the feline leukemia. We know that it's a retrovirus, and it affects only cats. We know that we can kill it easily outside of the cat, and different cats can have different amounts of the virus. I believe we looked at this. Okay. I'm sorry, we're going in the wrong way. Let's look at how contagious it is. Only 2 or 3% of all cats have FeLV, and that means that 97 or 98% of the cats don't have the virus. So it's contagious, but it's not that highly contagious. When I think highly contagious, I'm thinking about Panleuk, Khaleesi, viruses like that, ringworm. This is not in that same category. It simply is fairly difficult to get. Merck, in their studies to produce vaccines, have done studies, and they put cats in a high-risk category, that up to 30% of the adult cat population is at risk for getting FeLV. And if you look at the list of ones that are there, the only one that's missing is this healthy adult cat. And for healthy adult cats, which is about 70% of our population, it's very hard for them to get FeLV. However, for these other cats that are at risk, it's because they have a damaged or compromised immune system or an immature system. And in particular, kittens. We have to be very cautious about kittens because they are much more at risk even than an adult sick cat. So kittens are the ones that we are most concerned about when we look at how contagious FeLV. Let's spend a little bit of time about testing. We have to ask these days, why are you testing for FeLV? If you are doing just TNR, for example, and that's your mission, you want to trap the cat, you want to sterilize the cat, and then put the cat back where you found it, there's no need to be doing any testing for FeLV. If you are going to encounter a sick cat and you take the sick cat to the vet to see what's wrong with the cat, this is the time that you may want to be testing for FeLV and doing some blood work and looking at other things. So that's when you want to perhaps do some testing. Are you going to house this cat with some other cats? That's a good reason that you would want to test for FeLV. So think about what your mission is and where you can best spend your money when it comes to cats. And when you test the cat, we have some wonderful screening tools. The SNAP test has proved to be the best of the point of care or screening test, and that was some studies done by Dr. Levy. And the SNAP test proved to be superior to all the other tests that were available. And even though it's the best test that we've got and it's inexpensive, it still produces far too many false positives. So keep in mind that we don't want to make any life or death decision based upon a false positive. So that's why we want to do perhaps some other testing, or we simply don't want to rely on that single SNP test. Now, the cats can test positive one day and negative the next. I know that we love to put them in boxes, categories, as Dr. Levy points out, and we know cats love boxes anyway, so it's kind of natural that we want to put them in one, but it just doesn't work out. We can't have that certainty because they can change the cat's immune response to the virus and how much stress a cat encounters. These are things that really affect the outcome of a test. Bottom line, we don't want to be euthanizing any cat just because it tests positive for FeLV. We do have a wonderful new test that's come along that can be a confirmation test for FeLV, and that's the quantitative PCR test. It's the IDEX test number 26355, and I always call it out by number because IDEX has a number of tests with very similar sounding names, and it's really easy to get them confused. It's replacing the IFA test. So that's definitely one thing that we want to point out today. It replaces the IFA test because it's more accurate, it gives far more information, and it's at least the same cost or less expensive than the IFA. So that's the reason that we have switched over to this, using this quantitative PCR test. And it gives us a measure of just how much virus is in the cat system. It counts the number of copies of the virus that it finds in a milliliter of blood. And 1 million or more copies of the virus in a milliliter of blood is considered a progressive infection. And if it's less than that, it's considered a regressive infection. And a little bit more about these regressively infected cats. These are the ones that seem to be able to live for years with the virus because their immune system is keeping the virus at bay. They are positive for FeLV, but they are not contagious and they are not shedding the virus. Now, the progressively infected cats, they are also positive for FeLV, and they are contagious to other cats, and they are much more likely to develop FeLV-related disease and have a shorter lifespan. The number that we get from that viral amount of virus, we call the viral load. And that number can change over time. So this qPCR test is a test just at a point in time. And that can change over time, and it can change certainly from cat to cat. The important reason that we recommend the 26355 test is that this actually does two tests. Besides the quantitative PCR test, it does a lab-controlled ELISA test, which is looking for the P27 antigen. Now, this is somewhat like the SNP test in that it's looking for the P27 antigen. However, this is a much more accurate test. It's done by professionals who do this test day in, day out, and we get the best results. They're very accurate. It's not like the SNP test where various things like humidity, storage, how the test was run, the time that it was done, all of those factors play such a difference in how the test is read that it's not nearly as accurate as this lab-controlled ELISA test. And then if we find that we get a positive on the ELISA portion of that test and a negative on the PCR portion of the test, this points to what we call a focal infection. Now, these focal infections, for some reason, the virus seems to land in a certain organ of the cat, and it is not circulating in the bloodstream. So that's why it is not detected by a blood test such as the PCR. So if it's negative on the PCR but positive on the ELISA test, that's when we call it a focal infection. And these cats, we consider them to be regressively infected and not contagious. Ever since we got this ability to give us the viral load, we've kind of gone crazy, thinking all sorts of numbers or things about that number. we really need to caution ourselves. We've got that number. That's great. That's wonderful information, much more than we ever had before. And we know a little bit about what it means. We know that progressively infected cats are much more likely to have a shorter lifespan and to develop FeLV related disease. And that cats that are regressively infected, we know that they can live for many years. So we know sort of in general terms what this viral load means. That is, if it's either progressive or regressive. But that's about all we know. We don't know what the relationship is between that number and illness that can develop in the cat. We just don't know. And we don't know how the quantity of this number matters. If it's 5 on one cat and then 50 on another cat, is that 10 times worse? We just don't know. So we need a lot more information and research in this area. We do know that we see cats that have extremely high viral loads and they're thriving, they're healthy, everything is fine. And yet we know some cats that have very low viral loads, they weaken and die. So we need much more research in this area. And to add more frustration to us, some cats go undetected. It's estimated that up to 10% of cats that actually have FeLV go undetected. Now, it can be for a number of reasons. Maybe they have an amount of virus that is below the detection level of the screening test. That's possible. We say that no test is perfect and no vaccine is perfect. We also know that the incubation period for FeLV is about a month. So unless you know the exposure history of that cat you're testing for a month before you tested it, you may be testing within that incubation window and there's just not enough virus yet for a test to catch it. So bottom line, we have the best tests, vaccines, and knowledge. They're better now than they have ever been before. But we still need more research and we need more improvement in the future. Now, especially for those people considering mixed households, you want to ask yourself just how much, or is your cat at risk for getting FeLV? And we know that in the entire population of cats, only 2 or 3% of those cats have FeLV. Now, those are our healthy adult cats. And we also know that in studies done by Merck, that this is the list of things that cats are at more risk for. These are cats that have weakened or compromised immune systems, and especially kittens. So if you have negative cats that are in this category, you have to ask yourself, is that worth the risk? Or are your negative cats, maybe they're perfectly healthy now, but what do you expect them to be like in future years? So this is something you really want to look at. Kittens by far are the most at risk. Dr. Ford, who is a wonderful veterinarian and researcher, especially on vaccines for FeLV cats, estimates that kittens are 10 times more at risk than anything else for getting even an adult sick cat. So kittens are particularly vulnerable to being FeLV. And in addition to that, kittens have a developing immune system. Now, some kittens will clear the virus. If they do, it is probably within the first 6 months of age. And we don't know when a kitten's immune system is going to kick in and start doing what immune systems are supposed to do. So this is something that if you test a kitten, and you can do it at 2 months, you can do a qPCR test as soon as you can get a blood sample from the kitten. So you can do that at age 2 months. But you really want to be cautious and don't think of that as a definitive result, because kittens do have a real good chance of clearing the virus. And typically, if they are 6 months of age and haven't yet cleared the virus, chances are they're going to have that virus for the rest of their lives. Bottom line, this is how your cat is going to get FeLV. It is really hard for a healthy adult cat to get feline leukemia regardless of the exposure. However, a cat that has a compromised or weakened immune system, those are the ones that possibly can get it. So you have to have an uninfected cat that is able to welcome that virus into their bodies. So you have to have a cat that is at risk to begin with, and then you've got to get it infected, and it can come from mom. Typically, that's where it happens, or they get bitten by an infected cat. It's not spread by just casual contact. We have excellent vaccines, and in particular, we have one that is fairly new. We have a new vaccine from Merck. It's a 2-year vaccine, so after the initial dose, which is like 2 doses, 3 or 4 weeks apart, it's a 2-year vaccine, which makes it more welcoming to many adopters because they have maybe less trips to the vet. And it is an FDA approved vaccine. And this means that it went through some very rigorous testing in its development. And some of their samples test, they had 100% effectiveness, but the sample sizes were small. So I'm never going to claim that a virus is 100% effective, but this one is as good as it gets. It's really an excellent vaccine. Now, when it comes to mixed households, this is typically the way it goes. We have an owner that has a bunch of cats. They've lived together their whole lives. They don't go outdoors. And one day, one of them turns up sick. So the owner takes the cat to the vet, and lo and behold, the cat tests positive for feline leukemia. So now you've got some things that you need to do. You certainly want to work on a treatment plan for the infected cat. You do want to go ahead and get that 26355 test from IDEXX to determine whether your cat is regressively infected or progressively infected. It makes a difference in the treatment plan that you may elect for a cat. For example, if you have a really high progressively infected cat, you may elect for a fairly aggressive treatment program. So that gives you information that is valuable for you and your veterinarian. You want to test all those other cats to make sure that they don't have FeLV, and those that are negative, you want to make sure that they get vaccinated against the FeLV virus. And now it's decision time. Do you keep all those cats together? They've been together their whole lives, or do you separate them? So that's one thing this is how most of the mixed households happen. It's accidental, but we have more and more people that are openly considering mixing households deliberately. So when you have a mixed household accidentally, you don't have the opportunity to make those decisions until after one of them you have found out that you have a positive cat intermingled with your negative cats. So either way, it is now decision time. What do you want to do? We are seeing more and more mixed households all the time in our studies. Now, the only 100% way to prevent FeLV from spreading is to keep the positives separate from the negatives. That is the only 100% sure way of doing it. I know lots of people that have both positive and negative cats, and they use doors very effectively to keep the positive cats separated from the negative cats. They can enjoy the same space in the house, but just not at the same time. So that's one way of certainly sort of having both positive and negative cats and yet keeping them separated. Now, we also know that just getting cats spayed and neutered substantially reduces the risk of that virus spreading, and that vaccinating the negative cats further reduces the risk of the virus spreading. So the risk of the virus spreading in a mixed household with vaccinated cats is low, but it's not zero. And the primary method of virus spreading at that point is long-term mutual grooming. There's no getting around that. So you want to ask yourself if your cats are groomers of each other. That's a possible thing that you want to really think about. I've said before how wonderful I think TNR is. It's just such positive outcome. You're reducing the kitten population and you are reducing disease. So I can't say enough about TNR. And we certainly, if you are TNRing and you find that you have a positive cat, don't euthanize that cat. If you do TNR only, put that cat back where you found it. If it's a feral cat, it's not going to like living indoors, and there is no risk at all to the community cats. The risk is solely on that individual cat. Because he does have FeLV, he is prone to getting those secondary infections and diseases. So the risk is all on that cat. And we said it before that this is just the importance of the spay and neuter work that you're doing. It's preventing disease from spreading, and of course, it's reducing the population of cats. And just a word, we have expert guidance on cats with FeLuc, and this comes from the Association of Feline Practitioners. I've got links to so much of this stuff in the slides, and there is a handout, there's a paper that goes along with this. So feel free to download that and look through that. This is one particular study that I like sharing with the veterinarians because they can easily click through the slides from Dr. Levy's presentation and get to the science beneath it, look at the actual data, so they can become up to speed on feline leukemia fairly quickly. Now, when it comes for caring for a FeLuc cat, most of this you'll notice is just very basic recommendations for the care of any cat that is perhaps more compromised and needs to see the vet more often. Stress is a huge factor when it comes to cats, period, and FeLuc cats seem to be even worse at that. So you want to eliminate stress in this cat's. That is a huge role in the health of the cat and how the cat progresses with the FeLV. I do urge you to join a Facebook group. There's one out there, Owners of FeLV-positive Cats. It's an excellent group, about 18,000 people. They are very knowledgeable. Some of these people have had cats for decades, cats. So they're very knowledgeable. They know how to care for these cats. They're very happy to make recommendations. There's lots of support there. So you don't have to own a cat to join that group. So that is the one thing I would recommend for you, is to join that one Facebook group. We know that adoption is the outcome that we want for these cats, and I think 69% of you agreed with that to begin with, so that's just huge. And we know from studies, Austin Pets Alive adopts out several hundred of these cats each year, and they've done customer satisfaction surveys that point out that huge numbers really like these cats. They think of them as being special, they're saving lives, and they become repeat adopters. So there is a wide number of people that want to adopt these cats. So it makes sense that you're able to adopt them. You can network them through social media or locally. And if you're considering social media, I urge you to look at the paper that goes with this presentation. When you're working with social media and networking cats through social media, there are some really do's and don'ts. So please be aware of that and consult that as just some extra guidance if you're looking to network your cat through social media. We want to remove barriers to adoption. I've heard horror stories with how perhaps some rescue group spends months trying to find the perfect home for a rescue cat, and they miss the opportunity then to maybe find homes for 100 other cats. So we really want to drop some of the barriers to adoptions, that instead we want to focus on educating adopters. Make sure the adopters understand FeLV. You can give them presentations. There's lots of things that you can do to educate adopters. Some groups even have mentor programs. Someone that's already adopted a cat with FeLV, they sort of pair them up with someone who has FeLV cats, and you certainly can learn a lot from someone who's had that experience. Send them to that owners group on Facebook. That's an excellent way that they can get support with their adoption of the FeLuc cat. So we know that a adopter is going to do what an adopter is going to do. So let the adopter make the decisions about the cat. They make every other decision about the cat, what food it eats, what kind of toys it gets, everything. So it is very important that we get adopters making those decisions. And the whole thing is that we want to educate the adopter so the adopter has the best possible knowledge to make those decisions. And if an adopter wants a mixed household, that's okay. I'm not here to tell you that it's a good thing or a bad thing. I'm just saying it's okay. And a lot of you seem to be coming to that conclusion as well. The goal is to adopt the cat into a loving home, and you want to save one more cat. Veterinarians, can't say enough about them. They're actually absolutely the best possible people. And I have found that even if the veterinarian doesn't know much about feline leukemia, if you share some of Dr. Levy's videos or webinars with the veterinarians, they can look through that information and become very knowledgeable. And if they're willing to learn alongside you, then that's just worth its weight in gold. Here are some of the key takeaways I'd like for you to have. Remember, we're just not going to kill cats anymore because they have a virus. That is just too old school, and we're not going there anymore. We know that FeLV just really isn't that contagious. We know how it's spread. We have excellent tests. We have excellent vaccines. And we know that the goal is adopting these cats into loving homes. Now, some extra considerations that you want for mixed households, you definitely want to get that test 26355. You want to know if your cat is progressively infected or regressively infected. If the cat is regressively infected, it's not contagious to your other cats. However, maybe it could become progressive in the future, so you have to consider that. You have to consider if your cats, your negative cats, are in any of this category of at-risk cats, especially kittens. You want to be very careful with your kittens. If any of your negative cats are young kittens, really think about this before you put mixed households together. I consider deliberately mixing households. It's a personal decision. The risk is low, it's very low, but it's not zero. And it comes down to how much risk are you willing to accept. As we've mentioned, we want to reduce the risk as much as possible. We've gone through some of this. There is still a risk of long-term mutual grooming. When it comes to shared food and water bowls, this is not quite a myth. It is possible. It's just very not probable that it's going to happen. Just quickly consider a water bowl. If you've got a third medium, such as a water bowl, from going from one cat to another, an infected cat can take a drink of water and the virus is in the water, no problem. The virus is very wimpy outside of the cat. It will die easily. If that water is anything different than the internal temperature of the cat, it's not going to live very long. So let's say another cat, an uninfected cat, comes along, takes a drink of water quickly afterwards, and the virus is now in the uninfected cat's mouth. Consider just how hard it is to get from the mouth of the cat to the bloodstream. Is there an open wound in the cat's mouth that's bleeding that it might get into? Well, it's possible. It's just not very likely to happen that way. So the risk of that happening through a third medium like water or food or feces, it is just so improbable that you can ignore it as really a method for transferring FeLV virus. Now, the remaining risk, it is that long-term mutual grooming. So that's what you want to be on the lookout for. You certainly want to take into account how healthy your negative cats are and see if you're willing to accept that risk. The risk is low, but it is not zero. And just some extras here. There's plenty of links on the slides and also in the handouts for this. I emphasize the Community Cats podcast. You're listening to one of their programs now, this conference. I can't say enough great things about Stacy and her crew. They put on quality content year-round, and it's very inexpensive. So you are getting the best bang for your buck by attending the webinars that she provides and the TNR certifications all year long. I would also, there's a link for this Focus on Felines. This is a group that comes out of the Haas Initiative, and they do a program the first Thursday of each month that you're welcome to attend. It's free. And they do always programs that are cat oriented and very interesting. Next Thursday, I'm giving a presentation there also about mixed households. So you are welcome to attend that, bring your questions. It's much more of a discussion oriented group. So we'll be happy to talk about mixed households, Feline cats, anything that you would like. So please join us there. And again, I'll give you my contact information there. You can reach me by email. I'm always available there. And I'm on that Facebook group, owners group. So feel free to come there. And I'm on there a lot. So be happy to network with people, answer your questions. And with all that, I will turn it back to Stacy, and we will try to answer some of your questions here.
Fantastic. Margaret, great presentation. I'm going to apologize ahead of time because I was on there's like a Facebook posting. There were people who wanted to join the group, and it's about a 2-year-old feline leukemia positive cat up for adoption. And they've listed her as has a regressive case of feline leukemia, and then it says, which can shorten her lifespan. We're hoping to find her a loving indoor only home where she can live out her life, blah, blah, blah. But if it's regressive, that means it's less transferable than progressive, right?
Correct.
So at 2 years old, doesn't she have kind of a good chance for, not like a forever life, but at 2 years old, she's got some good chances here, right?
I'm trying to find the webcam here.
Oh, yes. Let's send you a thing.
May have to help me with, there we go.
There you go.
Okay.
Sorry. I'm so distracted by this cat.
Okay, there we go. All right. Yes, a regressively infected cat. It was not long ago. I read a similar post, and this lady's cat had just died. Regressively infected cat, 21 years old. And I didn't know whether to congratulate her because her cat had made it to 21. I certainly offered my condolences because when you lose a loved cat, it doesn't matter, So regressively infected cats, I hear 15 years all the time for regressively infected cats. So it's like the virus is there in the cat, but the immune system of the cat is keeping up with the virus. And from my experience, these cats, they make it a long time. And it's kind of a thing with Feline cats. They can be healthy their whole lives, and then they can crash and be gone rather quickly. When the virus takes over, it does take over, and we lose the cat, and often it is a very quick thing. It is not like, diabetes or some of these more degenerative type viruses. It can happen very quickly.
All right, I'm going to go through the questions here. So does the new Merck vaccination require 2 doses?
Initial doses, yes. I think most all of the vaccines require like a double dose, like 3 or 4 weeks apart. But yes, the Merck 2-year vaccine, it is an initial two doses initially, a month apart, and then it's a 2-year vaccine. So that helps out some adopters.
A second question here. What do you do if rescues will not accept a cat if it does not already have a negative FeLV test? I know I ran into this issue a lot with veterinarians not wanting to spay neuter cats without testing. And then, and I'm sure these conversations would happen at a rescue level. I'm not sure what you would advise this person to do.
Get on that owners group and ask the question there. We keep a list of places that will accept Feline cats, and we're happy to share that information to others. And certainly, if it's going into a situation where it's going to be housed with other cats, that's a good reason to test for FeLV. If all the animals are being housed in individual kennels, then there's no need to test for FeLV. They're not going to spread it to their next door friend. Not going to happen.
Okay, so that is, here we go. What is the lysine caution with these cats?
Oh, lysine's a good one. We get into arguments all the time about lysine. There are studies that show it basically doesn't do much for your cat. However, there are other studies that show that it is very effective for herpes-related virus, especially that which affects the eyes And let's face it, feline leukemia cats, it's those secondary infections and diseases that we are always fighting. So they are always prone to getting herpes type URIs, and that can actually help the cats. So I give lysine to my cats, and the thing about it, it's cheap and it's not going to hurt the cat. So I'm sort of on the side of, yeah, I use lysine, but I'll admit that, it's probably not going to do anything for the feline leukemia or the FIV. It just isn't. At least it's never been proven. But it is going to help with the herpes and maybe some of the other things that these cats get.
This is a question about our local high quality, high volume TNR program recommends euthanizing feline leukemia positive cats. Even after hearing Margaret, I worry about feline leukemia cats getting sick out in the colony over time, dying harshly. And could they be false positive or regressive? Is this still a worry? And Kristen, if you want to throw the link into why it's okay to return FeLuc positive cats to a colony, article I wrote of several years ago, feel free to throw that in there. But Margaret, what are your thoughts on this topic?
That's exactly what you should do. Put that cat back in the colony. Now, that cat probably is not going to live as long as, some of the other, what is it, about 7-8 years is about the length of time that a feral cat makes it out in the wild. There's just so many things that can get to them: dogs, predators, hawks, road kill, the cars. It's just very difficult for a cat out in the community. But that cat is of no risk to any of the other cats. And chances are that cat is not going to die a horrible death. It is, if it has a feeder in the community, there maybe is a time to capture that cat again. And maybe if the cat is very sick, that's when humane euthanasia is appropriate. But that cat might be regressively infected and could live for many years out there in the community, just like he has been doing since the day he was born.
Great. Okay, let's see here. All right, so we have questions about adoptions and sort of general educational information. Are there any handouts out there that can help explain all of this in a way that makes sense for adopters that can be used in the adoption process for folks?
Yes, there sure are. If you go to Maddie's Fund and Google FELV, you can find handouts that are available. Austin Pets Alive also carries those on their website, and they're like crib sheets. I've got one that I'll be happy to send to people. If you want to email me, I'll send it to you. You can provide them like the handout or papers or slides from this presentation. There's a wealth of information that you can give adopters. It's probably overload. I really like the idea of pairing new adopters with previous adopters that can kind of mentor people. I like that. If you've been connected to someone that's been through that experience, it really is helpful. And certainly that Facebook group, I can't recommend it enough. The owners of FeLV positive, FIV positive cats. It's a huge support system. And we get so many posts. I think you just started one. I don't know anything about FeLV, but I've just found out my cat's tested positive. What do I do? And the first thing I sort of urge is take a deep breath. It's not the end of the world. And then other people will chime in and offer advice on everything from food to, just lots of things, and be very supportive and kind and helpful.
Yeah. I'm going to mention out there, Finn, you put 2 long questions in here. I'm going to recommend that goes directly to Margaret. So we'll make sure you get her email address and you can email her directly on that case. And then another, just to confirm, how is feline leukemia passed from cat to cat?
It's queen to kitten, either in utero or through nursing. And it doesn't even have to be the biological mother of the cat. Colony cats are kind of known for nursing each other's kittens. So it could be that a kitten from an uninfected mother is nursed by an infected cat and gets it through nursing. So that is number one. And then it's through deep bite wounds with adults, particularly males, fighting each other and mating. So it's that saliva to blood transfer that is in adults that is a risk for infection. That is by and large how FeLV gets spread. That's pretty much it.
Got you. Amanda, I'm also going to kind of defer here. That's you're asking some sort of veterinary questions, and I don't dare bring up veterinary questions, but maybe Margaret, you can answer that on the side. I just don't want you to feel like we're treating you like a veterinarian here.
Yeah, and I am not. I couldn't be a veterinarian. I can't stand the sight of blood, so I wouldn't make it very far.
If we have a known positive mom, should we remove the kittens, either to bottle feed or let mom groom, or just remove the kittens completely?
Oh, no. If you have a cat that's nursing, let her nurse the kittens until they're weaned. You don't want to burden yourself with neonates trying to feed them. Most of them aren't going to make it, and it takes a huge amount of resources for you to do that. I am a proponent of spay abort. If you can get the cat while it's pregnant and spay the cat, it's better off for the cat because there's a lot of stress on that cat for a pregnancy and for nursing kittens. So the cat is better off if you can do that procedure before the cats are born. But once they're here, don't take them away. That's better for the cat, true, but it's a death sentence for the kittens. So I just don't recommend that at all. Let her finish nursing them, let her wean them, so in about 2 months they can go their own way. The cats probably, or kittens, will either have FeLV or they won't, and you can test them at about 2 months. It's just you can't make that a definitive test. You want to test them again, certainly at 6 months if they're positive.
Yep. Another question here. If you have a sick colony, do you recommend spot testing? I can tell you at our Sunday spay neuter clinics for feral cats, we don't do testing. If the cat is sick and struggling and suffering, we make a choice to euthanize regardless. We let the cat tell us what it needs, not a test to tell us what it needs. But that's our opinion here.
Yeah, I think that's an excellent way to approach it. And I like veterinarians approaching it that way as well. You can tell a lot about the body condition of a cat. If you've got a dying cat on your hands, you've encountered it, there's no need to put that cat through testing. The cat is dying. So, you humanely euthanize the cat. I like that approach. Now, if the cat is just sick, it looks like it would make it. And so, you can give a injectable, a long-term antibiotic. And certainly then you want to do maybe some basic blood work to find out what's going on with this cat. So a blood panel is called for, and that's when you would want to do a FeLuke test as part of that. Let's see what's going wrong with the cat protocol.
Yeah. I mean, one thing I've always been told is if you're going to do a test, don't just test for testing's sake. Test if you have a designated action plan lined up and what you're going to do as a result of that test. And if that test is foolproof and it's telling you some valuable information, then great. But if it's going to tell you lots of more questionable things, why spend your resources on testing when you could put those resources into spaying and neutering more cats?
Well said. I totally agree.
Yeah.
Totally.
I had this conversation many years ago with a veterinarian, and she goes, well, I totally understand why you wouldn't test if you didn't have the resources. And I said, well, I don't have the resources to test. That's why we're refusing to pay your bills for testing. Like, this is why. So, going back to the rescue that's requiring I mean, we're just not going to pay those bills because we just don't, the resources are tight. People don't realize, I mean, they think that there's flexibility there, but there were months at MRF for us when we didn't know if we were going to cover the rent the next month. So I wasn't going to pay for a combo test for community cats, that's for sure.
I am sure that there are a whole bunch of people that are thinking exactly the same thing. They are in shelters, municipal shelters in particular, and rescue groups. They're trying to do the best they can with a lot of volunteers typically, and they're doing a huge amount of good. I mean, I praise these people. They're just so wonderful, and they're making a difference. I mean, we see it. We see that less cats, because we're out there doing that TNR. I mean, we are doing the right thing and we want to keep doing it. And the stewardship of, as a donor, and my foundation donates money for these positive outcomes for cats. So I'm very interested in how they spend my money. And I don't want them just throwing it away. I want them to really think about and focus to where they can get the best bang for their buck.
Excellent. Margaret, as always, thank you so very much. Great presentation.
You're very welcome. So glad to be with you here today.